Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Kindly like, subscribe, and share for more. Have you ever pondered why understanding the epicondyles and condyles of the humerus is paramount? Today we delve into this subject. The humerus is more than just a bone in your upper arm. It's a beautifully constructed piece of human machinery with two key components, namely the epicondyles and condyles. These structures play a pivotal role in the movement and stability of our arms. The condyles, composed of the capitulum and trochlea, form the elbow joint, allowing us to flex and extend our arm. The epicondyles, on the other hand, are the bony prominences on either side of the condyle. They serve as attachment sites for muscles and ligaments, providing strength and stability to our arm movements. So, the next time you're lifting, throwing, or simply waving, remember the crucial role these structures play. Having a solid knowledge of these structures is crucial, not only for understanding our body's function, but also for diagnosing and treating related conditions. Now that we've established the importance of these structures, what are the common causes and signs of conditions affecting them? Epicondylitis, often referred to as tennis elbow, and condylitis, known as osteoarthritis, are typically caused by overuse, injury, or conditions like arthritis. Overuse is a common culprit, especially in sports or jobs that require repetitive arm or wrist movements. Injuries, such as sprains or fractures, can also lead to these conditions. In some cases, arthritis, an inflammatory disease affecting the joints, may cause epicondylitis and condylitis. The typical signs to watch out for include pain around the elbow or knee, swelling and limited movement. The pain may be sharp and occur suddenly, or it could be a dull ache that worsens over time. Swelling is another indicator, and it often comes with redness or warmth over the affected area. Limited movement, especially difficulty in straightening the arm or leg, can signal these conditions. Early recognition of these signs can lead to timely diagnosis and effective treatment. Recognizing the signs is one thing, but how do healthcare professionals diagnose these conditions? Well, the process begins with a comprehensive physical examination. Doctors will examine the patient's arm, focusing on the elbow's pain points. They'll look for tenderness, swelling, or redness around the epicondyles and condyles of the humerus. They will also ask about the patient's medical history. Have they experienced similar symptoms in the past? What kinds of physical activities do they engage in regularly? This information can provide valuable context and guide further investigations. Next, imaging tests like X-rays or MRI scans may be utilized. These advanced tools allow doctors to see inside the body, providing a detailed view of the bones and soft tissues. They can reveal any inflammation, damage, or abnormalities that might be causing the patient's symptoms. In some cases, further tests may be needed to rule out other conditions. But in most cases, this approach provides a clear, accurate diagnosis, which is crucial. An accurate diagnosis is the first step towards effective treatment. With a diagnosis in hand, what treatment options are available and what complications might arise? Well, the treatment for epicondylitis and condylitis can often be a multifaceted approach. Physical therapy is a common first step, focusing on exercises that strengthen and stretch the muscles around the humerus. In some cases, medication can be used to manage pain and inflammation. If these conservative methods are unsuccessful, surgical intervention may be considered. This could involve removing damaged tissue or repositioning tendons to alleviate strain. Now, let's talk about complications. If left untreated, these conditions can lead to chronic pain and even loss of function in the arm. The persistent inflammation might cause the elbow to stiffen, limiting movement. In severe cases, untreated epicondylitis and condylitis could potentially lead to a complete rupture of the tendons, requiring complex surgery and a long recovery. So remember, adequate treatment not only alleviates symptoms but also prevents serious complications. Prevention is better than cure, so how can these conditions be prevented? You can do so through a few simple yet effective measures. Regular exercise is key, as it strengthens the muscles and tendons around the humerus, reducing the strain on the epicondyles and condyles. But it's not just about doing any exercise, it's about doing it right. Using proper technique during physical activities is crucial. Incorrect movements can put undue stress on these structures, leading to conditions like epicondylitis and condylitis. What's more, don't forget to give your arm a break. Overuse is a common cause of these conditions, so be sure to rest your arm periodically, especially after strenuous activity. To sum up, understanding the epicondyles and condyles of the humerus is crucial for diagnosing, treating, and preventing conditions that affect them. Remember, the health of your arm hinges on these small but vital structures. UMCC, your ultimate medical consultant connectors. But medical,